very serious. This could be one of the most serious types of infections that a person can get in terms of having long-term implications neurologically, deafness, um, and can even be fatal. I'm curious about the meningitis vaccine and the strains that it currently covers. Can you discuss in detail the coverage that kids get now and whatever is out there that is not being covered? Okay, so first of all, this needs to be further delineated. Okay, meningitis is an inflammation of the meninges, which is the membrane that surrounds the brain and spinal cord, and it can cause some very serious. This could be one of the most serious types of infections that a person can get in terms of having long-term implications neurologically, deafness, um, and can even be fatal, depending. Now, most meningitises are viral, and there is not a vaccine for them. Viral meningitis are often less dangerous than the bacterial ones. So that's first to start. Now, it also depends on age groups. Okay. So in babies, young children, toddlers, the more common bacterial meningitis, there's two: streptococcal pneumoniae and Haemophilus influenza B. Both of them have specific vaccines, the Hib vaccine and the pneumococcal or PC or Prevnar vaccine. There's a couple of different Hib vaccines as well, but those are targeted for those. They're typically, they're given up until 5 years of age. They're not even given after that point, unless there's some immunocompromise or other. Now, Haemophilus influenza B, I have never seen this since leaving my residency. So this has been a not yet this millennium type of thing. Okay, streptococcal, and that's of any force. Now, Haemophilus influenza B can also cause what we call a periorbital cellulitis, where it can quickly take over the skin around the eye and can invade the eye. That's a terrible thing. I've never seen any of this, or sepsis. It can cause sepsis as well. Now, streptococcal pneumoniae, much more commonly, this causes an ear infection. It doesn't cause meningitis, but it can cause sepsis, etc., as well as meningitis. Now, I have a suspicion, though, that what this particular question is about is against a particular bacteria called Neisseria meningitidis. Okay. Now, this is something that vaccines are not given to young children. It's something that is given to older children. So it is. These are things. Now, there are two different vaccines. Okay, and there's a couple different versions of each. One is called the meningococcal that targets groups A, C, Y, and W. Okay, and this is something that the CDC is recommending to be given to older kids, as well as to, and if not done beforehand, as a single dose when somebody is going into college in like a residential dorm type of situation, or people who are going into like the military and are going to be in army barracks. That does seem to be the higher risk for an otherwise healthy individual. Those do seem to be the more at-risk individual. Now, in addition to that, there is the meningitis, which is called Group B. Now, this is something that first of all, it's not something that is being universally recommended by the CDC. The CDC says you can get it, you may get it. It's the wording such as that, as opposed to the should word, which was being used for the previous one. But there has been some outbreaks going on this year, and in Florida in particular. Now, the population that it has been hitting in Florida is actually in gay men. And as with what we've talked about previously with monkeypox, this is not a gay disease, just like HIV was not a disease of gay people. It is passed along by close spread. And so, if there is within a particular population more of a given disease of whatever it is, and there is close contact with amongst that group, it is more likely to spread. Okay, so please do not be saying this is another gay disease. I mean, like, that's baloney. I reject that completely. But that is what that's about. And there is the vac, and if a person is in that higher risk group, similar to how people talk about how there is the vaccine available for monkeypox in the high risk group, that's where a person may get more benefit. But again, it's not something for young children, and it's not even that one's again not even something that's considered universal. If you like this video, please see the description below and click the link for the full episode. And if you haven't already, please subscribe to this channel and join us on social media.